thank you for joining us today. This is part one of an amazing series ahead. Quest Diagnostics recognizes advanced practice providers as a valuable member of medical practice today, and recognize that they serve as a primary caregiver for thousands of patients across the world. The main goal of the series is to provide NPs and PAs with education, tools, and resources to improve patient care and enhance their practice efficiency. My name's Sarah Walsh. I've been a practicing physician assistant for over a decade. I work within the clinical education department here at Quest Diagnostics in the Cardiometabolic Center of Excellence at Cleveland Heart Lab. I'm joined today by Dr. Betsy Cirolia and Betsy Cirolia. Betsy, Jesse, thank you so much for joining me today.
Thanks for having us. Thank you for letting us be here.
Awesome. So if you could give the audience just a brief introduction, quick summary of your amazing background, that would be great.
So I'm Betsy Cirolia. I've also been practicing for a little over 10 years as a family nurse practitioner. Most of my experience has been in family practice. So we're seeing the gamut of ages. We're seeing the gamut of chronic, acute, women's health, peds, all of it. I would say that we really do a good job with family. And there's some families that I see 20, 30, and 40 family members within one group. And it really just captures like the whole spectrum of life. I've also been an adjunct at several colleges and universities teaching undergrad and grad nurse practitioner and nursing students, mostly patho, research, adult health. And I do precept probably my entire career. I currently have 2 students now that are rotating with me. So I do think education is just so valuable in preparing our next generation to take just as good as care of me, hopefully when I get older.
Hi, my name is Betsy Cirolia. I'm a family nurse practitioner. My career began about 46 years ago as a medic in the Army. When I got out of the Army, I got my associate's degree and then went on and got my bachelor's degree and then got my master's degree while my kids were in middle and elementary school. And I've been in family practice most of my career as a nurse practitioner. I spent 20 years as a trauma and critical care nurse in ICU. I believe that gave me a lot of really good patho basis to helping to treat people. I've also been an adjunct. In fact, I worked in family practice predominantly until the last maybe 10 years where I worked in urgent care predominantly. I've treated people from womb to tomb, have done pretty much everything there is to do in nursing and as a nurse practitioner. Currently, I am a volunteer at Shepherd's Hope. I love going there. I still love what I do, and that's why I keep going.
Ooh, ladies, those resumes. Oh my goodness. That's amazing, amazing history. Thank you so much for those introductions. So let's jump into it. Really what I'm hoping to focus on today, our talk on today, is, advanced practice providers being agents of change and how APPs can advocate for and implement proactive preventative healthcare in our daily practice. We're always hearing prevention is the best medicine, right? In your opinion, how does catching disease early or focusing on prevention impact patient care for you?
Oh, 100%. It is the stitch in time that saves 9. Truly, if you're looking at people on a regular basis or their primary care is paying attention regularly, it's more likely you're going to catch stuff early by looking for it. You can clean your house or you can clean your house. You go look for stuff. And that's part of our responsibility to patients based on how they present. Certain health issues for a patient lead us to think about other things that could be happening. And the whole reason why we test and investigate is to try and identify things as soon as we can.
Yeah, and I think when we are identifying early, it's reducing disease burden. It's reducing costs on patient, on the healthcare system as a whole.
Hugely.
If we're able to prevent them from even seeing specialists, especially our backgrounds in family practice, and we really try to capture as much as we can before we need to send to a specialist, because sometimes that's also increased cost, but it's also increased time. A lot of those specialists have, 2-3 months out before they can get to see somebody. So if we're really working to the top of our licensing, and then sometimes that means that we are staying up to date on our own with continuing education or researching things that are, aside from work, I get so much joy from like continuing ed personally. Like, I'm just like, oh, I can't wait to apply this, to my next patient. Or I'm sure that we've all had that time where we've had that light bulb, like we learned something. We're like, I know the perfect person for this. And you're like, can't wait to call them and like help to get them to that answer that you've been just like scratching your head on. So, I mean, it really helps build your relationships with your patients because they learn to trust you. I mean, if you find something on somebody that gives them an answer that they wouldn't, they maybe have waited years to get, or, somebody didn't listen, enough, and then they come to you, like, there's nothing better than that. I mean, I had a patient actually today that was a family member of a patient I had seen, about a year ago that I continue to see, but he came in for his physical. He had a mass on his thyroid. He had thyroid cancer. And she's like, I came here because you saved his, you found his cancer. And
Wow.
so like, he hadn't had a physical in many years. And that's a way that he came in for one thing, you find another, but you're catching it as early as you can identify it. And, luckily thyroid cancer is not as scary, but like had it waited many more years, who knows? But sometimes if you're not touching your patients enough, you're not listening to your patients enough, those are things you're going to miss.
Right.
Yeah. And I think you raise so many important points when really it's going back to being that patient cheerleader, right? I mean, you want to make sure that you're developing that rapport, that you're listening, that you're connecting, because I think that really, down the line helps you significantly in treating the whole person that sits in your room that day.
You really do benefit yourself and the patient by, first of all, listening, which is sometimes hard in the pace of a busy practice. And I'm not experiencing that so much now, but I do remember the days where, you're seeing 3 and 4 people an hour, and you really try to get as much in as you can, knowing you probably can't hit all the points of necessary follow-up in one appointment. And again, emphasizing that, if you take the time to explain to your patient and maybe draw cartoons even, that they understand what it is you're talking about, they are more likely to believe you, first of all. And they are also more likely to buy into what we're kind of selling, which is our expertise. I tell everybody, you're the captain of your ship. I'm your navigator. I'm going to lead you on the safest path I possibly can for what I know about health. I will take care of as much as I can for you here.
I've heard you say before, Betsy, help patients live the life they want with better health, which, connects all of what you just said, right? Really allowing them a space to understand them, understand what their concerns are, making sure on your end that you are being as thorough as possible. And as Jesse had mentioned, working to that top of your licensure really allows, for that scenario to happen, and really taking that holistic approach.
When you listen to what they're worried about, you also want to make sure that you've underlined and highlighted whatever the health concern is your blood sugars are getting less well controlled, you're gaining more weight, whatever it is.
This field, you do have lives in your hands, right? And if you aren't, focusing on being thorough and, putting prevention first, you could be missing these impacts that we're talking about. I think one point to bring up is really, when you're focusing on prevention or you're focusing on identifying a disease earlier, is really thinking about the patient's circumstances, right? You know what I mean? We have kind of all of this knowledge to say, okay, we need to be doing this, this, and this to prevent X or whatever it may be. And you have to take into account, circumstances like finances, right? What is their budget for grocery intake and those things to really almost meet them where they are. Do you find that that's something, that you find helpful?
There are a lot of things, to help support. I know that actually even Quest is really great about self-pay rates, like one of the best, honestly, with working with patients. And some of these more newer tests is cost we worry about, but they're very actually affordable and they're better tests. So, I mean, I think that there's still a way to kind of meet a patient where they are financially and still be able to get the results you need and the information you need. Sometimes it's using, like GoodRx and like other resources too, to find more affordable medications or utilizing free lists if they're available at any of the local pharmacies to try to get them the medication they need. Sometimes it's just trying to be creative, and it takes a little more thought.
I think as providers, really seeking out things like this, right? A free podcast where, you could play in your car on your way in, and it provides education, right? I think, more traditionally, we think about CME, that you're taking a week away from clinic and you're going to sit in a conference room. There are so many free resources for education specifically. In what I do in my role here at Quest on a daily basis is provide education to providers that are asking for it, right? Whether that be a phone call, whether that be, assisting with, providing literature, whether that be taking more of a deep dive from a clinical perspective. We have to know that those resources exist to make education and make staying up to date easier.
So I learned something new, and I can see total value in it because, again, it helps me to maybe really drive the point home for somebody that's just not seeing the signs that are coming, the writing that's on the wall that they're missing.
Yeah, for sure. Well, so many great points there. I think taking the initiative to identify disease earlier and focus on prevention has so many positive impacts, right? We went from thinking about not only just lowering the cost of care and promoting patient and provider satisfaction and improving outcomes. And that's really, and reducing that disease burden is really what we're striving for here. And, I think we did a great job of really highlighting those key points from an impact standpoint. Now, I think it's helpful for providers. As I mentioned, we want to make this easy. We want this to be impactful for providers when they're listening. So I always find it helpful to hear about how providers are incorporating preventative medicine in their practice. So many listening, may be thinking, how am I going to fit preventative care in my 15-minute appointment that's often double booked or sometimes triple booked? Mm-hmm. What are some of the strategies that you use within your clinical practice?
Yeah, I find chart prepping is incredibly helpful. If you have access to an EHR that allows you to get into the chart before their visit is started, which previously my EHR didn't, and now that it has, it's like changed my life. So I go in there and I'm already looking at their labs. I'm already typing in what I'm thinking about for these labs, what my next steps would be. And then I'm also thinking, okay, when was their last mammogram? Have they had a colorectal screening recently? Are they due for any other additional labs as far as preventative stuff goes? Look at how terrible their cholesterol is. Maybe next time I consider doing an advanced lipid panel, or maybe I'm doing something different because now their A1C is high and I'm thinking about other things. And so it gives me an opportunity to think about the patient before they're right there in that room with me. And so I've already kind of taken a holistic view of that patient from outside. And so my note is mostly written up and I just have to add in what I need for that day. And so when I get into that room, it's all about what the patient needs as opposed to my agenda, because my agenda is pretty much typed up and ready to go. And so I usually like to listen first before. And so I'm like, hey, what brings you in today? And if they're we're going over the lab, I'm like, great. Do you have anything else you want to talk about before we dive in? Or have you had a chance to look at them? And, a lot of times I'll hear, well, I don't know, I'm looking at them. I'm like, oh, great. That's why you're here. Let's go through them together. And then it gives me an opportunity to kind of provide more education and kind of go into that a little bit more and then let them know hey, I noticed when I was looking at your stuff, you're due for this, you're due for that. And it gives me a chance to close those gaps and to, again, make sure that we're providing that whole quality piece. And I don't have to be stuck in my computer because my note is mostly done. Type up a few things here and there, but then I can actually really focus and engage and actually listen to the patient. So, I said it more than once, or I think already even today, just about listening is so important. And I don't know how many people, I think it's my favorite compliment they get when people tell me you actually listen, I come to you because you actually listen. And, I don't think we do that enough. And I think if we do listen, I think we're going to get way more history than you ever hoped you would get. And you're going to learn way more about that patient that may change some of your focus and how you treat them, as far as that goes. If you only talk about your agenda, you're only going to get your stuff ordered, and you may miss something totally, maybe she had something terrible happen before she came in, or maybe her knee hurt and you walked out and yet she never got to, and then the patient doesn't feel like their needs were met.
Well, even just acknowledging the concerns, right? I think Jesse makes an amazing point by saying, asking if there is something on their agenda, right? Before you get into your own. You have to do that in order creating an environment that, you are really truly focused on, what they came in for. One of the things that I wanted to circle back to is, talking about the computer, right? We've had so much benefit in medicine from electronic medical records. Some probably electronic medical records are better than others, but I think that, it really can provide an environment that might be disengaging for patients, right? So if we're not focused on them and we're focused on the computer, it can really interrupt not only preventative care that we're trying to educate on or discuss, but any type of care when you are looking into a computer screen versus connecting with the patient. Do you find, how do you approach that? So how do you approach your setup? How do you approach connecting with that patient when you still have to do all of these things as far as a charting perspective?
And I find too that I don't have my computer directly in front of me and the patient right behind it. It's kind of off to the side, here, and the patient's over here. Yes. So that way I can look at them more, and it's getting in the habit of typing and talking too, looking at them. And I do have a tendency as well when I'm actually doing their physical exam. Some of the questions maybe I reserve to when I stand up and I'm looking in their ear. How's your ear feeling today? Are you having any pain? I noticed that you said that you were having some drainage, or you noticed a little redness. Were you seeing that? And so then the conversation is just lending to as I'm doing their exam, and then I can always type up a little bit more later. So that way it feels a little bit more organic, a little bit more natural, as opposed to just I'm a robot and I'm going to type this.
It's personalized.
Yeah.
It's personalized.
And two, also integrating preventative medicine in that time during the exam, right? You know what I mean? When you're examining, asking about those things that are on your agenda, in regards to preventative care, it's a helpful time, right? Because then you're getting the information that you need, but yet, and checking off things from an agenda perspective, it can be very helpful. So we hit on some main points. I think, when we're trying to incorporate preventative health or preventative care, being proactive, really trying to target identifying illness and disease earlier, being mindful, making sure that we are engaging, right, to get the history that we want, making sure that we find a balance between what we need to do from our own agenda and what the patient has come in for, so their own agenda. I think, Jesse, Betsy, you gave, great examples in regards to how we can prepare ourselves walking into that visit, whether it be chart prepping, whether it be, smart sets or dot phrases, or having, templates to our visits. And then I think, really the highlight of being realistic in what we can cover, spending time and making sure that we are, going through each point on our agenda from a preventative health standpoint or early identification standpoint, and spending the time we need to address that. Any other tips, comments?
Just one more takeaway point. I would just stress that taking care of your patients is a journey, right? And sometimes that it evolves, and what you need today isn't the same thing you're going to need the next time you see them. And just understanding that we are moving very much so to preventative medicine, right? I mean, the idea of fee for service is moving away, and quality is really coming hard and heavy. And so it's time to get prepared for that new wave of care and also reimbursement. And so the sooner you jump on that bandwagon and understand it's not always about the quantity, and it really is about the quality time that you spend with your patients. The idea is to help you not get burned out, but also to care for your patients better than maybe we previously had. And hopefully we continue down that route.
Well, thank you so much, ladies, for joining me today. This was an amazing part one of the series. We look forward to sharing education, tools, and resources to help identify disease earlier, incorporate risk stratification, and improve patient care. We look forward to seeing you again.